Knock, knock. So I would start by introducing myself to the patient. Hi, my name is Chris Torres. I'm going to be your nurse today. But first of all, can you tell me your name and your date of birth? Can you also show me your ID band to make sure everything matches up? Okay, great. So like I was saying, my name is Chris. I'm going to be your nurse today. And I'm going to do a physical assessment on you, okay? Since you're newly admitted, I have to make sure nothing has been missed and that everything is fine, or at least make sure I check everything. Sounds good? Okay. So, first thing I would do is, move the curtain to provide for privacy, raise up the bed, and then lower down the handrail. Now that that's been done, I will perform hand hygiene for at least 30 seconds. Once that's been done, put on my gloves and proceed. Before I start, do you have any allergies to anything, such as latex, medications, or food? No allergies? Okay, great. So, I'm going to start off by taking some vital signs, okay? Now, before I start, is there anything that you may have done that affects the results, such as chewing gum, drinking coffee, drinking iced water, working out, smoking? No? Okay. I'm going to grab my thermometer. And now that I'm here, I'm also going to check for any IVs, dressings, make sure that any tubing isn't kinked or that no Foleys are in, that if they have fluids running or if they have a pump going, that the rate is fine. Now that that's been checked, I'm going to grab my thermometer. Okay, I'm going to start by taking off your temperature. Let me put on my plastic probe cover over this. And now I'm going to leave this in your mouth for a couple of seconds, okay? Okay, while that goes, or while that runs, I'm going to also check your pulse, okay? I'm going to check your radial pulse. And I would also check for respirations, but I can't tell him that until after, because if I tell the patient, that will affect their rate of breathing and might give us an inaccurate result. Okay, your temperature is done. Okay, temperature is 98.2. I would write that down right away for my documentation. Take off the probe, clean it off. Okay, I'm gonna check his or her pulse now. May I see your wrist? Cross that over your abdomen. Alright. And so I would count for 30 seconds. After the 30 seconds, I would also count for the respirations. But since this is not a human being and I have to make up the result, I'm just gonna save you some time, and we're gonna pretend that 30 seconds have passed. So 30 seconds have passed, and after counting it for 30 seconds and multiplying it by 2, I have concluded that the patient's pulse is 82 and their respirations are 16, which I would also write down so I can document in a bit. And also, his or her pulse was strong. The rate was 82, of course. It had a normal rhythm. Now that I've taken that down, next off, I'm going to check your blood pressure, okay? Now, to check your blood pressure, I would make sure I have the proper cuff size. Since this is a baby, I would get a baby cuff, but, we're just going to pretend that I do have a baby cuff. So, let me grab my cuff. Okay. I'll grab this right here. I'm gonna wrap that snugly. Make sure a finger can still fit under there. Make sure the artery line lines up with the artery. Also, I'm gonna ask the patient what their normal blood pressure is. That way I know to pump 20, 30 more above the regular. Okay. I'm gonna put my stethoscope on. Turn it on. Okay. This arm is really tiny, but obviously I would put the stethoscope right here, right below the cuff, but we'll just make do. So I would pump 30 above patient's normal pressure. In this case, the patient said their normal pressure is 124/86. I'm gonna slowly release until I hear the first beat. First beat is heard at 126. I'm gonna keep releasing more until I hear the last beat. Last beat is heard at 82. Okay. Very well. I would also write that down for my documentation. Alright. After that, I need to check your O2 stats. So I'm going to put the pulse oximeter on your finger. I'm going to write down what it indicates. Pulse oximeter says the patient's O2 level is at 99%. I'm going to write that down as well. Also, I'm going to compare the radial pulse I took to the pulse that the pulse oximeter measures. And let's see, it matches up. Yes, the patient's pulse is 82. Last vital I need to take. Are you in any pain, sir? From a scale of 0 to 10. Ah, I see. Your pain is at a 4. I would advocate on the patient's behalf for any medication. Would you like something for that? No? Are you sure? Okay. So patient denied medication. Although if asked for, I would check with the provider. Alright, now that the vitals are done, we're going to keep going on with the assessment from head to toe. As this assessment is being performed, I will also be checking the skin constantly for the color, edema, the temperature, moisture, texture, turgor, ulcers, tattoos, piercings, any kind of body art, bruises, lesions, and such, and edema. Okay, so noting that my gloves are still on and from when I washed my hands at the beginning, I'm going to assess your scalp first, okay? And let me ask you as well, if you don't mind, can you tell me your name? Okay. Can you tell me today's date? Okay. Can you tell me where we are? Okay. And who is the president? Alright. Patient is alert and oriented ×4. And why are you here? Oh, because you have a headache. I see. Okay. Okay. Sounds good. So I'm going to proceed with assessing the scalp first. I'm going to check the skin of the scalp, the texture, make sure there's no infestations. Now that that is done, I'm going to keep going down. Alright, now we're going to move down to the face. Now I'm going to assess your facial nerves. So can you raise your eyebrows? Good. Can you puff out your cheeks like this? Good. Now smile. Okay. Now show me your teeth. Excellent. Okay. I'm also going to assess your ears and nose. Let me grab my pen light. Okay. Using my pen light, I'm checking the ears for any cerumen or wax, drainage, any other anything out of the normal, any lesions. Okay. Also gonna check the nose. Gonna check for any discharge. Checking the patency of the nares. Okay, the nose looks fine too. Now I'm gonna use my tongue depressor to check his mouth. Open wide. I'm gonna use this tongue depressor to press down on your tongue, checking the mouth for any sores, lesions, any signs of infection. Okay. Everything so far seems normal. I'm also going to assess the patient's eyes. Alright. So, do you have any vision problems? Such as headaches when you have to see far or close? Do you wear glasses, contacts? No? None of that? Okay. Well, I'm going to shine this pen light in your eyes, but I need you to just stare at me, okay? And I'm checking for purple. Okay. Watch my pen. Okay. Can you cover one eye? How many fingers am I holding up? How about now? How about now? Good. Got them all right. Same on the other side. Okay. Excellent. And pupils were reactive. Everything is fine. Now we're going to keep moving down. I'm going to assess the head, neck, and shoulders. Can you go ahead and turn your head? Okay. Move your neck around, up and down. Any pain or stiffness? No? Okay. Move your shoulders up and down if you may. Okay. No stiffness, no pain. Excellent. Range of motion seems good so far. Now we're going to keep moving down. Now I am going to listen to your lungs. Sounds good? Alright. And do you have any lung issues right now today? Like coughing, wheezing? Do you have any asthma, anything like that? Are you a smoker? No? No? Okay. Okay. Gonna put on my stethoscope back on. Alright. Then I'm going to auscultate all three lobes on the... Yes, all three lobes on the right side, all two lobes on the left side, both front and back. So here we go. Now go ahead and sit up for me. Okay. I wouldn't push down on their face like that, but so I listened to their lungs. Respirations were deep. They sounded normal. I didn't hear any kind of wheezing or no kind of sounds. No abnormal lung sounds. They were breathing at a normal rate. Once again, I counted 16 breaths per minute. So far, everything checks out fine. Now I'm going to move on forward. I'm going to listen to your heart now. Okay. And I would listen to the apical pulse. So go down the intercostal spaces and to the right there. And I would listen for S1, S2. Also noting that after listening for a minute, noting that the rate lines up with the pulses that we're taking. Heart rate is 82. It's good. The rhythm is normal. It's got a strong beat. Okay. And like I said, I would listen for the S1 and S2 sounds. Also, now that while I'm checking the heart, also gonna go ahead and I'm gonna palpate the carotid arteries one at a time. Also gonna auscultate one at a time. Okay, so far so good. I'm also gonna check the jugular. I need to learn how to say that. Jugular veins for distension. Okay. No distension noted. And now we will keep going on. I'm gonna move down to patient's arms. All right. Can you go ahead and move your arms around? Just checking for range of motion. Okay, good. Now, I'm going to do the capillary refill test on the patient's fingertips. Okay, Blanche test has been passed. Also, we're gonna check both radial pulses again. So bilateral radial pulses. Once that's done, also gonna ask them to grasp or squeeze my hands with both hands just to assess the strength. You are one strong baby. Okay. Now we're gonna move down to the abdomen. So, have you had any change in your eating habits? Any newly brought on abdominal pain, diarrhea, nausea, vomiting? No? Okay. Well, I'm gonna auscultate your abdomen, if that's okay with you. And also, I'm gonna check the abdomen for any lesions, surgical incisions, any edema, any distension, any discoloring, bruising. No, everything looks good. Okay, gonna auscultate in all 4 quadrants. 1. Okay. Normal bowel sounds. I will also now percuss all 4 quadrants as well. Okay, and I'm also going to palpate all 4 quadrants. All right. I'm going to make sure they don't have like I said, a Foley or any drains coming out. No? Okay. And how is your urinating been? Any changes in the color of your urine, the smell, how frequently you void, any pain? Okay, no? Okay, sounds good. Now we're going to keep moving down. We shall be assessing the muscles down here. Can you go ahead and kick your leg up, kick it back towards me? Good. Okay, any stiffness, any pain in there? No? Alright, wonderful. Well, I'm going to palpate the pedal pulses, which would be right here, like right before the toes. That's good. That's good. Okay, go ahead and pull on my hands. Now push. Excellent. Alright. I'm also gonna, I know this isn't in the rubric, but I would have them turn around and check for any sores on their bottom or their back, because that's very common in a hospital setting, especially for patients who are bedridden and have been in bed for a long time. Alright. But all that is done. Let me put my stethoscope right here. Now, let's see. Last thing I need to check is to do the psychosocial assessment. Now, who do you have here with you today? Oh, your mother. Excellent. I'm glad you have a good support person. Ma'am, do you mind stepping out for a few minutes? There's just some questions that I need to ask the patient alone. Thank you. So, do you feel like you have a good support network? Good. Do you feel safe at home? Is anybody hurting abusing or threatening you? No? Okay. Any wishes to kill yourself? Wish that you would wake up, or wish that you would go to sleep and never wake up? Or any intentions of wanting to hurt yourself or anybody else? No? Okay. Okay, that's good. Do you have any other concerns? Is there anything that we have not addressed? Any other healthcare concerns or questions you have? No? Okay, sounds good. Well, I am going to go now. I am going to put your bed back down. Gonna put that bed rail up for safety. Gonna put the curtain back where it was. I will be back, okay? As I walk out, I'm gonna wash my hands again for another 30 seconds. And lastly, I will go and immediately document or chart.